Broccoli is a worldwide favorite and popular superfood for healthy eating. But did you know that eating it wrong can be a real disaster for your health? In this video, we'll reveal 15 fatal broccoli mistakes that could cost you your life. Mistakes that are extremely rarely talked about but can cause stomach, liver, and pancreas damage, cardiovascular disease, and even kidney failure. From dangerous food combinations to improper preparation, you'll be surprised at how dangerous what was thought to be harmless can be. Watch to the end to learn how to avoid these mistakes and keep yourself healthy. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. Mistake 1. Consuming broccoli that contains pesticides and nitrates. This mistake can be a serious health hazard, increasing your risk of developing dangerous diseases such as liver cancer, kidney cancer, pesticide poisoning, and nervous system damage. Broccoli, like other vegetables, can accumulate pesticides and nitrates that are used during the growing process to protect against pests and increase yields. However, these chemicals, when ingested, can have serious toxic effects. Pesticides can accumulate in liver and kidney tissue, causing damage and increasing the risk of cancer. Nitrates, when converted into nitrites in the body, can react with amino acids to form carcinogenic compounds, increasing the risk of cancer of the stomach and other digestive organs. Research shows that regular consumption of foods high in pesticides and nitrates is associated with an increased risk of cancer. A study published in Environmental Health Perspectives found that people who regularly consumed vegetables with high levels of pesticides had a 20 to 30% higher risk of developing liver and kidney cancer compared to those who followed an organic diet. A Los Angeles hospital reported the case of a 45-year-old woman who suffered from chronic headaches, fatigue, and digestive disorders. During an examination, doctors found high levels of pesticides in her system. The patient admitted that she regularly consumed vegetables, including broccoli, bought at markets where sellers did not provide information about the origin of the food. After changing her diet and switching to organic products, her condition improved significantly. To minimize risks, it is recommended to buy broccoli from trusted suppliers who can confirm that the product was grown without the use of harmful chemicals. It is best to choose organic vegetables grown without the use of pesticides and nitrates. It is also a good idea to soak broccoli in a solution of water and baking soda before cooking to remove chemical residue from the surface. Thus, eating broccoli that contains pesticides and nitrates can lead to serious health problems, including cancer and toxin poisoning. Making informed food choices and following precautions can help you avoid these risks and keep you healthy. Mistake 2. Roasting broccoli at high temperatures. This mistake can be a serious health hazard, increasing your risk of developing dangerous diseases such as stomach, colon, liver, and pancreatic cancer. Roasting broccoli at high temperatures is a common mistake that can lead to the formation of toxic substances known as carcinogens. One such carcinogen is acrylamide, which is formed when carbohydrate-rich foods are cooked at temperatures above 120 degrees Celsius, 248 degrees Fahrenheit. Acrylamide and other carcinogens can contribute to mutations in cells and increase the risk of developing various forms of cancer. Studies show that consuming foods exposed to high temperatures significantly increases the risk of developing cancer. A study published in the Journal of the National Cancer Institute found that people who regularly consume fried foods have a 50% higher risk of developing stomach cancer compared to those who prefer boiled or steamed foods. A cancer center in Chicago described the case of a 58-year-old man who was diagnosed with stomach cancer. The man said that for years he had been roasting broccoli daily in olive oil at high temperature, believing that in this way he preserved the maximum benefits in it. However, doctors found that it was this habit that led to prolonged exposure of his body to carcinogens, which was a factor in the development of cancer. To avoid the formation of carcinogens and preserve the beneficial properties of broccoli, it is recommended to steam this vegetable or cook it at low temperatures. These cooking methods will retain the maximum amount of antioxidants and vitamins while reducing the risk of toxic substances. If you prefer roasted broccoli, however, make sure that cooking temperatures do not exceed 120 degrees Celsius and that roasting time is minimized. Thus, roasting broccoli at high temperatures can lead to the formation of carcinogens that significantly increase the risk of cancer. Choosing gentler cooking methods and adhering to temperature settings will help avoid these risks and keep you healthy. Mistake 3. Consuming raw broccoli when immune-compromised. This mistake can be a serious health risk, especially for immunocompromised people, as it increases the risk of gastrointestinal infections, food poisoning, and further weakening of the immune system. Raw broccoli, despite all its health benefits, can contain dangerous bacteria such as E. coli and Salmonella, which can cause serious infections. These bacteria can be present on the surface of broccoli, getting there from the environment during growing, harvesting, or transportation. For people in good health, the immune system can handle these bacteria, but for those whose immune system is weakened, such as the elderly, children, pregnant women, or patients with chronic illnesses, the risk of severe infection increases significantly. Research shows that the risk of contracting pathogens from eating raw vegetables increases, especially when vegetables are not adequately sanitized before consumption. The study, published in the Journal of Food Protection, says that about 30% of outbreaks of infections associated with eating raw vegetables are caused by E. coli and Salmonella bacteria, which are particularly dangerous for immunocompromised people. A New York City clinic reported the case of a 70-year-old man suffering from diabetes and immunodeficiency. The man regularly consumed raw broccoli and salads, believing it boosted his health. However, one day after a dinner of broccoli, he felt severe abdominal pain and was hospitalized with a diagnosis of salmonellosis. Doctors determined that the infection had entered his body through raw broccoli that had not been properly washed and processed. To avoid the risk of infection, broccoli should be washed thoroughly before consumption. And for immunocompromised people, it is preferable to prepare this vegetable by subjecting it to heat treatments such as steaming or lightly frying. This will not only kill pathogens, but also preserve most of the beneficial substances contained in broccoli. Thus, consuming raw broccoli without sufficient processing can lead to serious infections, especially in immunocompromised people. Thorough washing and heat treatment will help avoid these risks and keep you healthy without sacrificing the nutritional value of the vegetable. Mistake 4. Insufficient heat treatment of broccoli. This mistake can be a serious health risk because it increases the risk of developing dangerous diseases such as gastroenteritis, salmonellosis, and other foodborne infections. Broccoli, like other vegetables, can contain pathogens such as Salmonella, E. coli, and other bacteria on its surface that can cause serious infectious diseases. If broccoli is not heat-treated sufficiently, these microorganisms can survive and, once ingested, cause acute intestinal infections. This is especially dangerous for children, the elderly, pregnant women, and those with weakened immune systems. Studies show that inadequate heat treatment of foods is one of the leading causes of food infections. A study published in the Journal of Food Protection found that about 25% of food poisoning cases involve vegetables and other foods that have not been adequately heat-treated. These infections can lead to long-term health problems and can even be fatal in severe cases. A hospital in Miami reported the case of a 35-year-old woman who became ill after eating broccoli that had been steamed for just a few minutes. Within hours of eating it, she developed symptoms of severe gastroenteritis, including vomiting and diarrhea. Doctors determined that the cause was Salmonella, which survived due to inadequate heat treatment of the broccoli. The patient was treated with antibiotics and recovered for several weeks. To avoid the risk of infections, broccoli should be subjected to sufficient heat treatment such as boiling, steaming, or roasting at a temperature of at least 70 degrees Celsius, 158 degrees Fahrenheit, for at least 5 to 7 minutes. This ensures that all pathogens are destroyed while preserving most of the beneficial substances contained in broccoli. Thus, insufficient heat treatment of broccoli can lead to serious infections and food poisoning, which are health risks. Following proper cooking methods and sufficient heat treatment can help you avoid these risks and enjoy broccoli without worry. Mistake 5. Storing broccoli in plastic containers. This mistake can be a serious health hazard, increasing your risk of developing dangerous diseases such as breast cancer, prostate cancer, and endocrine disruption. Storing broccoli in plastic containers, especially for long periods of time, can cause the plastic packaging to release harmful chemicals into the food. One such substance is bisphenol A, BPA, which is widely used in the manufacture of plastic containers and packaging. BPA is a known endocrine disruptor that can interfere with the normal functioning of the body's hormonal system. When exposed to food for long periods of time, especially when stored at elevated temperatures, these chemicals can penetrate foods and accumulate in the body, which in the long run can lead to the development of various forms of cancer and other serious diseases. Studies show that bisphenol A, BPA, and other similar chemicals are linked to an increased risk of cancer, especially breast and prostate cancer. In a study published in Environmental Health Perspectives, scientists found that regular exposure to BPA is associated with an increased incidence of hormone-dependent tumors. It has also been shown that BPA exposure can disrupt normal endocrine function, which is especially dangerous for children, adolescents, and pregnant women. A case of a 42-year-old woman who developed breast cancer was reported in a London hospital. While talking to the patient, doctors learned that she often stored fresh vegetables, including broccoli, in plastic containers and regularly heated them in the microwave without transferring them to other dishes. Analysis showed high levels of BPA in her system, which may have contributed to the development of cancer. To minimize the risk of chemical contamination, it is recommended to avoid storing broccoli and other foods in plastic containers, especially if long-term storage is planned. Instead, use glass or ceramic containers, which do not emit harmful substances and are safe for health. If plastic containers are used, avoid heating food directly in them, especially in the microwave, as this increases the release of harmful chemicals. Thus, storing broccoli in plastic containers can lead to chemical contamination of the food, which increases the risk of cancer and endocrine disorders. Choosing safe materials for food storage and handling can help you avoid these risks and protect your health. Mistake 6. Consuming broccoli with intestinal disorders. This mistake can be a serious health risk, especially for people suffering from bowel disorders such as irritable bowel syndrome, IBS, chronic constipation, and abdominal bloating. Broccoli, being a rich source of fiber, is a healthy vegetable for most people, but for those who suffer from gastrointestinal disorders, excessive consumption of this vegetable can do more harm than good. Fiber in large quantities can cause an increase in symptoms such as abdominal bloating, flatulence, abdominal pain, and even trigger an exacerbation of irritable bowel syndrome. In addition, for chronic constipation, broccoli can exacerbate the problem if the balance between fiber and fluid in the diet is not maintained. Studies show that in people with IBS and other functional bowel disorders, consuming high-fiber foods like broccoli may worsen symptoms. A study published in the American Journal of Gastroenterology found that 70% of IBS patients experienced an increase in symptoms after consuming foods high in insoluble fiber, including broccoli. This is because such fiber can have an irritating effect on the intestinal walls, increasing inflammation. A case of a 45-year-old woman suffering from irritable bowel syndrome was reported in the gastroenterology department of a San Francisco clinic. After she began to add a large amount of broccoli to her daily diet, Her condition worsened dramatically. Severe abdominal pain and flatulence appeared. Doctors recommended reducing broccoli consumption and replacing it with products with a milder effect on the intestines, after which the symptoms significantly reduced. For those who suffer from bowel disorders, it is important to carefully control the amount of fiber consumed. Steaming or boiling broccoli is recommended, which can make the fiber softer and less irritating to the gut. It is also a good idea to combine broccoli with probiotic-rich foods, such as yogurt, to support healthy gut flora. It is important to maintain a balance between fiber and fluid by drinking enough water throughout the day. Thus, consuming broccoli for gut disorders can lead to worsening of symptoms and exacerbation of disease. A conscious approach to the choice and preparation of products, as well as taking into account the individual characteristics of the body, will help to avoid these problems and maintain intestinal health. Mistake 7. Excessive consumption of broccoli for pancreatic diseases. This mistake can be a serious health risk, especially for people suffering from pancreatic diseases such as pancreatitis, diabetes, and pancreatic insufficiency. Broccoli is known to be a rich source of vitamins, minerals, and fiber, but when consumed in excess, it can put an undesirable strain on the pancreas, especially in those who already have chronic diseases of this organ. The high fiber content of broccoli requires the pancreas to work actively to produce the enzymes needed to digest food. In people with pancreatitis or pancreatic insufficiency, this workload can lead to exacerbation of the disease, pain, and impaired digestion. Studies show that in patients with chronic pancreatic diseases such as pancreatitis, excessive fiber intake can cause symptoms to worsen. In a study published in the Pancreas Journal, researchers note that high-fiber diets require more enzyme secretion, which can put an excessive strain on a weakened pancreas, leading to a worsening of the patient's condition. A New York City clinic reported the case of a 50-year-old man who suffered from chronic pancreatitis. The man consumed broccoli in large quantities daily, believing that it would improve his overall health. However, after a few weeks, his condition deteriorated dramatically with severe abdominal pain, nausea, and loss of appetite. Doctors found that the excessive consumption of broccoli caused an additional load on the pancreas, which led to an exacerbation of pancreatitis. People with chronic pancreatic disease should consume broccoli in moderation and thoroughly cook to minimize stress on the pancreas. Steaming or boiling broccoli until soft is recommended to reduce the amount of fiber, which requires active enzymatic processing. It is also important to discuss the diet with a doctor or nutritionist to choose the best eating regimen that will not harm the pancreas. Thus, overconsumption of broccoli for pancreatic disease can lead to exacerbation of symptoms and worsening of health conditions. A conscious approach to nutrition and following expert advice can help you avoid these risks and maintain pancreatic health. Mistake 8. Consuming broccoli for liver disease. This mistake can be a serious health risk, especially for people suffering from liver diseases such as fatty hepatosis, cirrhosis, and liver failure. Broccoli contains many nutrients, including antioxidants and vitamins that are generally beneficial to the body. However, in chronic liver disease, excessive broccoli consumption can have a negative impact by burdening this organ. The liver plays a key role in metabolism, and when it is weakened, its ability to detoxify and process nutrients can be compromised. Excessive consumption of broccoli, which is rich in fiber and sulfur-containing compounds such as glucosinolates, can increase the burden on the liver and exacerbate already existing problems. Research suggests that patients with chronic liver disease should be cautious about consuming foods high in fiber and other substances that require active liver involvement in their processing. A study published in Hepatology noted that excessive consumption of such foods can lead to toxin buildup and liver deterioration, especially in people with cirrhosis or liver failure. A case of a 55-year-old man suffering from fatty hepatosis was described at a medical center in Houston. The patient, considering broccoli to be one of the healthiest vegetables, started consuming it in large quantities daily. However, after several months, his condition worsened. Weakness, jaundiced skin, and decreased appetite appeared. Doctors found that excessive broccoli consumption increased the strain on his liver, leading to an exacerbation of the disease. People with chronic liver disease are advised to consume broccoli in moderation and carefully monitor their diet. The optimal option will be to include a variety of vegetables in the diet in balanced portions, avoiding excessive consumption of a single product. In addition, a doctor or nutritionist should be consulted about formulating a diet suitable for the condition of the liver to prevent further deterioration of health. Thus, excessive consumption of broccoli for liver disease can lead to exacerbation of symptoms and worsening of the health condition. It is important to exercise moderation and be conscious about your diet to keep your liver and overall body healthy. Mistake 9. Consuming broccoli in the presence of kidney stones. This mistake can be a serious health risk, especially for people suffering from urolithiasis, kidney failure, and other chronic kidney diseases. Broccoli, like many other green vegetables, contains oxalates, compounds that can form insoluble crystals when combined with calcium. These crystals can accumulate in the kidneys to form stones, causing renal colic and impaired kidney function. For people who are prone to kidney stones, or those who already suffer from the condition, excessive broccoli consumption can worsen the situation, contributing to further stone formation and worsening symptoms. Research shows that high consumption of oxalate-rich foods is associated with an increased risk of developing urolithiasis. In a study published in the Clinical Journal of the American Society of Nephrology, researchers noted that patients with urolithiasis should avoid excessive consumption of oxalate-containing foods such as spinach, rhubarb, and broccoli to reduce the risk of new kidney stone formation and exacerbation of the disease. In the urology department of a Boston hospital, a case was reported of a 38-year-old woman who had recurrent kidney stones. The patient, unaware of the oxalate content in broccoli, daily included this vegetable in her diet. Doctors found that it was the broccoli in her diet that contributed to the formation of new stones and worsening of the condition. After eliminating broccoli from her diet and switching to a low oxalate diet, her condition improved significantly. People with urolithiasis or other kidney diseases should carefully monitor their diet, avoiding excessive consumption of oxalate-rich foods. It is important to maintain a balance between foods containing oxalate and other dietary components such as calcium and magnesium, which can help reduce the risk of stone formation. Consultation with a doctor or dietitian can help you adjust your diet and avoid further complications. Thus, consuming broccoli when you have kidney stones can lead to the formation of new stones and worsen chronic kidney disease. A conscious approach to diet and avoiding foods high in oxalate will help protect kidney health and prevent further problems. Mistake 10. Consuming broccoli if you have gastritis or a stomach ulcer. This mistake can be a serious health risk, especially for people suffering from gastritis, peptic ulcer, and gastroesophageal reflux disease, GERD. Broccoli, despite its many health benefits, can be harmful for those suffering from stomach problems. The high fiber content as well as the natural acidity of broccoli can irritate the inflamed mucous membrane of the stomach, causing an exacerbation of gastritis and ulcer symptoms. Consuming broccoli raw or in large quantities can increase inflammation, lead to abdominal pain, heartburn, and even cause ulcer recurrence. Studies show that in patients with chronic stomach conditions such as gastritis and ulcers, consuming foods high in fiber and high in acidity can worsen their condition. A study published in the World Journal of Gastroenterology noted that patients with peptic ulcers who included foods that irritate the mucosa in their diet were more likely to experience an exacerbation of symptoms and a longer recovery period. In the gastroenterology department of a San Diego clinic, there was a case report of a 60-year-old man who suffered from chronic gastritis. The man started actively adding broccoli to his diet, believing it would help him maintain his health. However, after a few weeks, he went to the hospital with complaints of severe stomach pain and constant heartburn. Doctors determined that the broccoli had irritated his gastric mucosa, aggravating his gastritis and causing it to worsen. People with gastritis, peptic ulcer, or GERD are advised to include broccoli in their diet with caution. It is preferable to consume broccoli in boiled or stewed form, which reduces its acidity and makes the fiber softer and less irritating to the stomach. It is also important to control portion sizes and avoid eating broccoli on an empty stomach. Consulting with a doctor or dietitian can help determine a safe amount and method of broccoli preparation for your particular stomach condition. Thus, consuming broccoli with gastritis or peptic ulcer can lead to irritation of the mucous membrane and exacerbation of the disease. A conscious approach to nutrition and the choice of gentle methods of cooking broccoli will help to avoid these risks and preserve the health of the stomach. Mistake 11. Excessive consumption of broccoli with thyroid disease. This mistake can be a serious health risk, especially for people suffering from hypothyroidism and other thyroid disorders. Broccoli, like some other cruciferous vegetables, contains goitrogens, compounds that can prevent the thyroid gland from absorbing iodine, which is critical for normal thyroid function. Iodine is necessary for the synthesis of thyroid hormones, which regulate the body's metabolism. In hypothyroidism or other thyroid disorders, excessive broccoli consumption can exacerbate iodine deficiency and further reduce hormone levels, which can ultimately cause metabolic disturbances, fatigue, weight gain, and other symptoms. Research suggests that in patients with hypothyroidism, eating large amounts of cruciferous vegetables such as broccoli may contribute to worsening symptoms. The study, published in the Thyroid Journal, noted that regular consumption of goitrogens may reduce thyroid activity in people with pre-existing problems, requiring special attention to diet. A case study of a 45-year-old woman suffering from hypothyroidism was reported at a medical center in Boston. The woman decided to increase the consumption of broccoli in her diet, believing this vegetable to be beneficial for her overall health. After a few months, her condition worsened. Weakness, constant fatigue, and weight gain appeared. Doctors found that excessive broccoli consumption led to a further decrease in thyroid activity and aggravation of hypothyroidism. People with thyroid disease are advised to consume broccoli and other cruciferous vegetables in moderation, keeping a close eye on the amount in their diet. It is important to ensure adequate iodine intake from other sources such as iodized salt, seafood, and supplements if necessary. A consultation with an endocrinologist can help determine the optimal dietary regimen that will support thyroid health and prevent negative effects. Thus, overconsumption of broccoli for thyroid disease can exacerbate hypothyroidism and lead to metabolic disorders. A balance in diet and a conscious approach to food choices will help maintain a healthy thyroid and overall body. Mistake 12. Overconsumption of broccoli for anemia. This mistake can be a serious health risk, especially for people suffering from iron deficiency anemia, chronic fatigue, and weakness. Broccoli, despite its health benefits, contains substances such as phytates and oxalates that can reduce the absorption of iron from food. This is especially important for people with anemia who already have insufficient iron levels. The vitamins and minerals in broccoli are good for the body, but excessive consumption of this vegetable can lead to iron deficiency, which exacerbates symptoms of anemia, such as weakness, fatigue, dizziness, and decreased immunity. Research suggests that people with iron deficiency anemia should avoid overconsumption of foods that may reduce iron absorption. A study published in the Journal of Nutrition found that phytates and oxalates found in cruciferous vegetables such as broccoli can significantly reduce iron bioavailability, especially if these foods are consumed in large quantities and without iron supplementation. A case of a 30-year-old woman with iron deficiency anemia was reported in a Los Angeles clinic. The patient increased her broccoli intake, hoping to improve her overall condition, but soon began to notice an increase in her anemia symptoms. After performing a blood test, doctors discovered that her iron levels had dropped significantly. After determining the cause, the nutritionists recommended reducing the amount of broccoli in her diet and increasing her intake of foods rich in hemi-iron, such as meat and fish. Thus, excessive consumption of broccoli for anemia can reduce iron absorption and worsen the health condition. A conscious approach to nutrition and a balanced diet can help avoid these risks and maintain normal iron levels in the body. Mistake 13. Consuming broccoli while taking anticoagulants. This mistake can be a serious health risk, especially for people taking anticoagulants, drugs that prevent blood clots and reduce the risk of stroke. Broccoli, like other green vegetables, contains high amounts of vitamin K, which plays a key role in the blood clotting process. Anticoagulants such as warfarin work by reducing blood clotting, which helps prevent dangerous blood clots from forming. However, vitamin K can weaken the effects of these drugs, which increases the risk of bleeding. Consuming large amounts of broccoli while taking anticoagulants can cause internal bleeding, anemia, and even stroke. Research suggests that patients taking anticoagulants should closely monitor vitamin K levels in their diet to avoid drug interactions. A study published in the British Journal of Clinical Pharmacology noted that foods high in vitamin K, such as broccoli, spinach, and kale, can significantly alter the effects of anticoagulants, increasing the risk of bleeding. A New York City hospital reported the case of a 65-year-old man taking warfarin after suffering a stroke. The man decided to include more broccoli in his diet, believing it to be healthy, but soon began experiencing unusual symptoms: bruising of the skin, weakness, and dizziness. Tests showed that his blood clotting levels had dropped significantly, threatening internal bleeding. Doctors determined that this was due to the consumption of broccoli, rich in vitamin K, which weakened the effects of the anticoagulant. People taking anticoagulants are advised to maintain a steady intake of foods rich in vitamin K, such as broccoli. This means that it is important to avoid sudden changes in the amount of vitamin K consumed so as not to interfere with the effects of the drug. A doctor or nutritionist can help design a diet that will ensure a steady intake of vitamin K and prevent dangerous drug interactions. Thus, eating broccoli while taking anticoagulants may increase the risk of bleeding and interfere with the drugs. An informed approach to nutrition and consultation with specialists can help you avoid these risks and maintain good health. Mistake 14. Consuming broccoli for heart disease. This mistake can be a serious health risk, especially for people suffering from heart disease, such as coronary heart disease, atherosclerosis, and heart failure. Broccoli, rich in vitamin K, which plays a key role in the blood clotting process, may affect patients with cardiovascular disease. Vitamin K promotes the formation of prothrombin, a protein that is involved in the formation of blood clots. For people with heart disease, this can be dangerous because increased blood clotting increases the risk of thrombosis, which in turn can lead to myocardial infarction or stroke. Research suggests that in patients with cardiovascular disease, the consumption of foods containing vitamin K, such as broccoli, should be carefully monitored to prevent excess clotting. In a study published in the Journal of the American College of Cardiology, researchers emphasized that a dramatic change in vitamin K intake could affect the effectiveness of anticoagulant therapy and increase the risk of cardiovascular complications. A case of a 58-year-old patient with chronic coronary heart disease was reported at a Chicago clinic. After including a significant amount of broccoli in his diet, the man began experiencing symptoms indicating increased blood clotting. Additional tests showed an increased risk of clotting, which was associated with high levels of vitamin K in his diet. Doctors recommended adjusting his diet by reducing his intake of broccoli and other foods rich in vitamin K, which helped stabilize the patient's condition. People with cardiovascular disease are advised to monitor their intake of broccoli and other foods rich in vitamin K. For patients taking anticoagulants, it is important to maintain a stable intake of vitamin K so as not to interfere with the effects of the drugs. A doctor or nutritionist can help you develop a balanced diet that will keep your heart healthy and prevent thrombosis and other cardiovascular complications. Thus, eating broccoli for heart disease may increase the risk of thrombosis and cause cardiovascular complications. A conscious approach to nutrition and careful attention to your health can help you avoid these risks and keep your heart functioning properly. Mistake 15. Consuming too much broccoli. This mistake can be a serious health risk, especially for people who are overly keen on eating healthy without considering the possible negative effects from an excess of nutrients. Broccoli contains high levels of vitamins A and K, which in moderate amounts are essential for normal body function. However, overconsumption of these vitamins can lead to hypervitaminosis, a condition in which excessive amounts of vitamins in the body cause toxic effects. Hypervitaminosis A can cause liver dysfunction, headaches, nausea, and even skin rashes. Hypervitaminosis K in turn can cause blood clotting disorders, leading to an increased risk of bleeding, or conversely, thrombosis. Studies show that excessive intake of vitamins, especially fat-soluble vitamins, such as vitamins A and K, can have toxic effects on the body. A study published in the American Journal of Clinical Nutrition emphasizes that hypervitaminosis caused by excessive vitamin intake is a serious problem that requires an informed approach to nutrition and possible medical intervention. A clinic in San Francisco reported the case of a 40-year-old man who was overly enthusiastic about healthy eating and consumed large portions of broccoli daily, believing it to be maximally beneficial to his body. After a few months, he went to the doctor with complaints of constant headaches, nausea, and skin problems. Tests showed that he had developed hypervitaminosis A, which led to liver malfunction and skin problems. Doctors recommended adjusting his diet and reducing his broccoli intake to moderate portions. To prevent hypervitaminosis, it is recommended to stick to moderate consumption of broccoli and other foods rich in vitamins A and K. It is important to balance the diet by including a variety of nutrient sources and not to get carried away with excessive consumption of the same food. Consulting with a nutritionist can help you create a safe and effective eating plan that will support your health without the risk of vitamin overdose. Thus, overconsumption of broccoli can lead to hypervitaminosis and related diseases. A conscious approach to nutrition and attention to the amount of food you consume can help you avoid these risks and maintain your health. How to use broccoli safely for maximum benefits. Broccoli is a truly amazing produce with many health benefits that can greatly improve your health. However, as with any other product, to maximize the benefits of broccoli, it is important to approach its consumption in the right way. First of all, it's worth remembering that balance is the key to a successful diet. Broccoli is rich in vitamins, minerals, and antioxidants, but overconsumption of this vegetable can do more harm than good. To avoid problems such as hypervitaminosis or digestive disorders, it is recommended to include broccoli in your diet, but not to make it the main component of your daily meals. Moderate consumption, about 1 to 2 servings per day, will provide you with the necessary nutrients without overloading your body. Cooking broccoli is another important aspect that requires attention. To retain the maximum amount of vitamins and minerals, it is best to steam broccoli or cook it in boiling water for no more than 3 to 4 minutes. Avoid prolonged heat treatment or frying at high temperatures, as this can lead to the formation of harmful substances and loss of beneficial properties. For example, frying at too high temperatures can produce acrylamide, which is a carcinogen. Storage of broccoli also plays an important role in preserving its nutritional value. It is best to store broccoli in the refrigerator, in glass or ceramic containers, to avoid possible contact with harmful chemicals that can be released from plastic packaging. If you need to freeze broccoli, remember that once defrosted, it should be cooked immediately to avoid loss of quality and risk of bacterial growth. Special attention should be paid to combining broccoli with other foods. To improve the absorption of iron from broccoli, it is recommended to consume it together with foods rich in vitamin C, such as lemon or sweet peppers. This will help to avoid a possible decrease in iron levels in the body, especially if you have a tendency to anemia. At the same time, if you are taking anticoagulants, you should be cautious about consuming broccoli to avoid drug interactions. Thus, broccoli can be an important part of your diet, bringing many benefits and promoting health. But for this, it is necessary to observe moderation, properly prepare and store this vegetable, as well as take into account possible contraindications. By following these recommendations, you will be able to get the maximum benefit from broccoli and maintain your health at a high level. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel.
Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos.